QI Power Hour this Friday morning. This is Chelsea Schwartz with the Health Quality Council in Saskatoon. For those of you joining QI Power Hour for the first time, this is a free monthly webinar learning series hosted by the Health Quality Council here in Saskatchewan. We bring together improvers from a variety of sectors with an interest in improving health to learn about quality improvement related topics. All of our sessions are recorded and available on the HQC website following the event. So if you do have to hop off at some point today, rest assured that by the end of the day, the recording of this session will also be available. And if this is a session that you find would be particularly valuable to any of your colleagues, feel free to pass along the link to them as well. You can also check out some of our previous recordings from our HQC website as well. While you're on our HQC website, we also invite you to sign up for our distribution list for QI Power Hour to ensure that you receive all future invites. Over the last couple of years, we've been really excited to see the continued growth of QI Power Hour throughout our home province here in Saskatchewan, as well as throughout the rest of Canada and even abroad. So thank you for spending an hour of your time with us and for your commitment to ongoing learning to improve the systems that you're each part of. So one of the tools that our speakers will be using today is the chat function. So we just want to take a moment to onboard you to this function as well as to give it a go. So I saw that a few folks were already chatting this morning. So I'd like to invite you to share the organization that you're joining us from this morning in the chat. You can click on the message bubble to access the chat function, and then we encourage you to send your comment to all participants so everyone can be part of the conversation. So we'll just give you a minute to check out that chat function and let us know the organization that you're joining us from. Excellent. Welcome to BC Safety, 3S Health, the Health Authority. Excellent. Looks like people are getting the hang of it. Thanks so much. We also invite you to tweet out about your insights and reflections during the session today. You can use the hashtag QI Power Hour and the handle HQCSAS. So with that, let's dive into our session today. I'm delighted to welcome today two of my researcher colleagues here at HQC, Jessica and Laura, for their session, Getting on the Same Page, the Difference Between Data for Improvement, Data for Research, and Data for Accountability. Jessica works with system partners to help them understand how their systems are working and identify opportunities for improvement through the use of measurement. Jessica holds a Bachelor of Science degree in Biology from Mount Allison University and a Master of Science degree in Community Health and Epidemiology from the University of Saskatchewan. She has also completed the Advanced Training Program in Healthcare Delivery from the Intermountain Healthcare in Salt Lake City, Utah. Laura supports healthcare system stakeholders in identifying and incorporating appropriate data to help inform health system redesign. Laura received her Bachelor of Arts degree in Psychology and her Master's of Science degree in Community Health and Epi from the University of Saskatchewan as well. Welcome to you both.
Thanks, Chelsea. So my name is Jessica and I'm here with Laura and we're going to walk you through the session today. So our focus for today is to help you appreciate the importance of measurement in supporting quality improvement work, help you impress your friends by being able to differentiate between the three types of measurement and describe the different attributes of each type of measurement, and help you understand how all three forms of measurement are important to understanding your system as a whole. So we're going to ask to hear from you right off the start. On the following two slides, please use the chat box to indicate what you see. And just a reminder, you can access the chat function by clicking on the message bubble towards the bottom of the screen. And this will launch the chat panel on the right side of your screen. So what do you see when you look at this image? If you're able to use your chat box and let me know what you see. Yeah, so it's looking like a few people are seeing a rabbit, a few people are seeing a duck. And what about this image? Yeah, so some people are suggesting this person's in trouble. We see a biker lying on the floor or the street. Some people might see a biker falling. So we know that perspective is important. When multiple people are asked to consider the same idea or image, or when they're asked to work together on something, they bring with them their unique personalities and their experiences, like their education, and this can impact how they interpret, react, and respond to things. Even small daily occurrences like how a person slept or how their commute to work was can influence how they respond to something later in the day. I've seen this in my own work life, and maybe some of you have too. When I've worked with teams to come up with a measurement plan, I've had people raise questions or push back on things like, how much data do we actually need? What's our sample size to show change? How often do we have to collect it, and how will it be analyzed and reported? I've spent time with teams in places of disagreement and frustration on methodology, reporting, and concerns about bias. And I believe that a lot of time this stems from the diversity of people on the team and their experiences. Your team may include clinicians, quality improvement specialists, health system leaders, and others. And all of these people bring their own understanding of measurements and beliefs and expectations about what a project should accomplish. The diversity of ideas can be a good thing, but it can also be challenging. Some of these challenges can be addressed through clear communication and agreement on what your project is trying to accomplish, but I think a lot of time too, the confusion can be related to varied understanding about the different types of measurements. We know that as measurement is important. What we measure shapes what we strive to pursue, and what we pursue determines what we measure. Measurement is a key component of the model for improvement, and so for those who are less familiar with this image, the model for improvement is one of a handful of fundamentally important frameworks used in quality improvement work. It's used for developing, testing, and implementing changes that lead to improvement, and it's based on three fundamental questions. What are we trying to accomplish? How will we know that a change is an improvement? And what change can we make that will result in improvement? Measurement is a critical piece to all of these questions. In their seminal article on the topic of the three types of measurement, Solberg, Mosser, and McDonald say, we are increasingly realizing how critical measurement is to the quality improvement we seek, but also how counterproductive it can be to mix measurement for accountability or research with measurement for improvement. So again, measurement is an important piece of improvement work, and it's critical to understanding the differences between the three types if you hope to be successful in any of them. So if you are interested in reading this paper, we've provided the reference here, as well as we're providing the link to the PDF of it in the chat box.
Perfect. Thanks, Jessica. So that leads us into our next session. So what we're going to do is we're going to spend a good portion of this presentation walking through the key characteristics of each type of measurement. Measurement for improvement, for accountability, and for research. So the first thing I want to do here is pause and do a quick check-in with all of you. Using the chat box that you just previously accessed with Jessica, let us know if you are currently collecting data or if you are currently working with data. What purpose do you feel like you're collecting or working on it for? Do you consider it to be for improvement, research, or accountability? Let us know in the chat box. Awesome, seeing a little bit of everything. Maybe leaning a little bit heavier to the improvement side. Okay, I'm going to move on, but thank you. So this is a chart that is often referred to when people are talking about the three phases of performance measurement. A form of it originates from that Solberg paper, and a more common version is seen in the Healthcare Data Guide by Lloyd Provost and Sandy Murray, which coincidentally is a really good book if anyone's interested. So good that Jessica actually has it sitting beside her right now. We're going to go into its content in detail, and it's going to act as our framework for this presentation. We'll work our way through this table and compare the characteristics of measurement for improvement to that of accountability and research. So if you just take a peek on the left side here, oh sorry, I thought you could see my cursor, but you can't. I have to turn my laser pointer on for you, or my arrow. If you take a look on this left side here, that outlines the specific characteristics. And then these three columns refer to how those characteristics look in improvement, accountability, and research. So we'll work our way through these rows. I'm going to start with the purpose or the aim.
So the purpose of improvement work is to seek to determine the effectiveness and efficiency of a process that is producing outcomes in a dynamic or real-time fashion. Quality improvement takes a practical approach to answer questions about the efficiency and the effectiveness of a process over time. We use data for improvement to observe lots of different things: the process performance, to obtain ideas for other improvements, test changes to see if they are actually improvements, and see whether or not any improvements we may have made in the past are being maintained. Let's compare that to the purpose or aim of accountability. The purpose of data for accountability, or what I've sometimes heard referred to as judgment, is to evaluate or judge the performance of a provider or an organization. Measures for accountability can be used for evaluation, reassurance, to highlight choice, and they are very often used to provide impetus for change. They are often collected for an external customer, but of course we can see them used internally by the organization as well. When we're talking about accountability, we are usually talking about data that are typically on outcomes or results, though definitely not always. And they do not usually provide information to us on how a result was achieved. And finally, let's look at the purpose or aim of research. So the purpose of research is, of course, to generate new knowledge. Research considers the efficacy of something, either a product or a process, to understand how well that thing is at producing its intended results in a controlled environment. And one thing I just want to pause and flag here is that throughout this presentation, when we're talking about research, we're primarily referring to classic research. So there are types of applied research that do not necessarily adhere to all of the attributes that will be discussed today. So just keep that in mind as we're talking through these different characteristics. So just to reiterate, research is typically concerned with the efficacy or how something works under ideal conditions. And compare that with improvement, which we said is about testing the effectiveness and efficiency of something within a certain context. And that, as I mentioned before, that's not to say that there aren't examples of applied research looking at understanding how things fit into that context. I'm going to pause here and just talk a little bit about why you're measuring something. It's important when you start your measurement process that you take a minute to think about why you are measuring. The tool or the approach that you choose to use will depend on the question you are trying to answer or the problem you are trying to solve. When you think through why you are measuring, the answer to that question will guide you through your whole measurement journey. I want to look at this through the lens of maybe a real-world example. So let's say we're considering surgical site infections. If we were looking at it through a quality improvement lens, we might ask the question, does implementation of new hair removal techniques reduce surgical site infections in our hospital? Let's take that same question and look at it through the perspective of accountability. We might ask the question, what is our current rate of surgical site infections and how does that compare to other hospitals in our area or other provinces? And finally, if we are looking at it through that classic research lens, we might ask the question, how could a new medication to control patients' blood sugar result in less surgical site infections than the current standard? So now that we've looked at how the different types of measurement might look in a real-world example, let's continue to work through the table containing the different attributes of measurement. So I've already spoken to the purpose or the aim of each type of measurement, so next I'm going to talk through test observability, bias, and the sample size characteristics. Test observability refers to, if we can observe the test of change taking place and intervene throughout. In improvement work, we are able to observe our interventions as they are working and see what the impact is and adjust accordingly. We focus on small tests of change through our plan, do, study, act cycles that allow us to try something, evaluate the results, and then try something else if it's not working. We can constantly reconsider our approach and our hypothesis based on the previous test of change. When talking about accountability work, we aren't interested in tests of change. We're just reporting on and evaluating our current performance. And in research, you have a test, but it's not one that you can necessarily constantly adjust based on some results. We can't observe the impact of change and learn from it throughout that process because typically you don't start to analyze results until you are completed the data collection process. Now let's talk about bias. In improvement work, we accept that bias exists. We try and keep that bias stable over time in order to lessen its impact, and when we design our data collection, we assume that bias will be there all the time. And if our intervention results in a change, we know that it has happened in the face of bias that occurs in the real world. For example, one bias that we often need to accept in quality improvement projects is that all patients are different from one another, and therefore, the intervention that we're testing could potentially work better for some compared with others, simply because not all patients are exactly the same. In accountability work, we are very aware of bias. Remember again that the primary purpose of accountability work is to compare and evaluate, so we try to be aware of bias and use statistical methods to account for it. A common practice for this is risk or severity adjustment, where you use statistical methods to eliminate the impact of bias or differences that may exist between the populations you're comparing. And in research, we also try and minimize bias. Like in accountability, there are statistical methods to do this, but another common attribute of research is to have control groups that are matched to your testing group. The goal is to control all possible variables other than those being studied. And this is one of the reasons why the results from research may underperform when they are applied to a real-world setting. The last one that I'm going to talk about before I pass it back over to Jessica is sample size. And sample size is an area that we often have a lot of discussion on, so I'm just going to spend a little bit more time on it. A common question that we hear when we're working with teams is how big of a sample size do we need to show impact? And there's actually a little bit of an art and science to this, and what you'll need to do is think about your context and rely on your local experts to help you answer this question. For example, if you're trying to improve processes around, let's say, stroke patients, you'll need to remember that strokes, on average, occur only once or twice a week in Saskatoon. So you're going to need definitely more than 1 or 2 weeks worth of data to know if change is an improvement. Let's contrast that with improving a process around receiving an X-ray at the Regina General Hospital. That is something that happens many, many times a day, and therefore perhaps a week's worth of data would be sufficient. In quality improvement work, the ideal people to collect your data are the people that are directly involved in the process, and therefore often the ones who are providing the direct care to the patient. Collecting data will only be one very small part of their job, so it's important to try to use data that already exists or to that which will be minimally invasive to collect. Remember that data isn't free, and you should think about what you want to know and how badly you need to know it. When generating information for accountability, the recommended practice is to use 100% of relevant data. Because data for accountability are intended to compare groups, their focus is on them being precise, valid, and reliable. And because of this, sample size is important. The samples need to be large enough to be precise, which means it often needs to be collected over a longer period of time. And these two factors, the large sample size and the longer period of time, are one of the reasons that data collected for accountability are not often relevant for data for improvement work. And finally, in research, sample size tends to err on the side of getting more than enough data, collecting data just in case you'll need it later. Research studies are time-intensive and can be costly and difficult to change once you've started. And one thing I think about is when I look back on the data that I used for my master's thesis, I only used a very small subset of the data collected to answer my thesis question.
Okay, so just bringing us back to our framework, we've talked about the first part, and now we're going to continue to work our way down the chart and talk about the second half. So if we think about our hypothesis, in improvement work, we aren't necessarily wedded to one hypothesis. We often have many that we want to test, and as we do small tests of change, we are flexible with the hypothesis we are trying, and we can change it depending on the results of our previous small test and what it tells us. Compare that with accountability, where again, we are not interested in change or testing anything, and again, there is no hypothesis. In research, our hypothesis is often not flexible. It starts with one fixed hypothesis, and you design a whole research project around it. It is time and resource intensive often, and so typically, if you were to want to test another hypothesis, it would be a different research project that you design and execute. And this is related to the testing strategy you use. Improvement work is all about small sequential tests of change. You can consider how an improvement team could be formed around one hypothesis, collect some data related to it, reflect on that, and then decide how to move forward. The small sequential tests allow the team to see quickly what is working and what isn't. If something isn't working, they can throw that idea out and try something else. In accountability, again, there's no testing strategy. We're not testing any hypotheses or ideas. We're only interested in the performance of a system at a fixed point in time. In research, there is a test, but typically it's one large test that is being considered. There's typically one hypothesis that we're testing, and we often only get one shot at it to understand, did A work better than B? To identify if changes that occur are improvements, we use different strategies as well. In improvement, data over time will often be displayed on run charts or control charts, and we use these tools to identify whether changes that occurred actually resulted in an improvement or not. Again, in accountability, improvement and change are not the focus. And in research, we use statistical hypothesis testing to compare two or more groupings to understand if one is different than the other or not. So if we move on to data type, in improvement work, we aim to use recent data or new data in our tests. Because we are collecting just enough data that we need for our small tests of change, it's not a big deal to stop collecting some data and start collecting some new data if we change what we're focusing on and want to test something different. For accountability, we aim to use the most recently available data. Because of this, and we want to use all of the available data, there can be long legs before the data can actually be reported. And as a result, information can be a bit out of date by the time we get it. And this is one of the reasons it can be difficult to use data collected for accountability reasons for improvement work. Finally, in research, we may use data that already exists, or we may try and collect new data. It really depends on the research design and what the question is that you're trying to answer in your research project. So finally, the last thing to consider in our framework is social conditions of use and confidentiality. In improvement work, the data collected is meant to just be used by the team working on the improvement project. Though the focus of improvement work is on processes and not people, people may be vulnerable to having their processes quantified and scrutinized. If it is shared too largely outside of the core team or your group, it could be interpreted incorrectly and shine an uncomfortable light on the individual people or groups. This is the opposite of what we're trying to accomplish with improvement work, and it can make people hesitant to participate if they're not sure of who's going to be looking at their data or how it's going to be interpreted. In accountability, the purpose of data is for general public consumption. So we want to ensure neutrality and objectivity with our data, but confidentiality is not the focus. Data generated from research is also intended for general consumption, but participants who take place in the study are de-identified. Participant anonymity is often a crucial part of research studies. The need for confidentiality is high, and there are standards for ensuring patient protection for individual subjects. So that being said, with all types of data and measurements, a key part is keeping people's data safe and private. Confidentiality and role of patient or client involvement is a big factor in whether a project requires ethics approval or not. There are tools to assist people in understanding whether or not their project requires ethics review. We're not going to go too much into detail of this here, but the University of Saskatchewan and the University of Alberta do have online tools to help walk you through some of these questions. And we've included links to both of these in the chat. We also want to briefly mention the idea of publishing. Publishing is important in research, and it's not uncommon to hear pushback from people who don't want to participate in improvement work because they believe they can't publish their work. But improvement work can be published, and there are guidelines that you can follow when preparing your improvement manuscript. These are called the Squire guidelines, and we've included a link to their website in the chat. Also on this website, you can find a list of journals that publish improvement work. So we've made it through our framework, again, highlighting the different attributes between measurement for improvement, measurement for accountability, and measurement for research.
So now let's pause again and turn it back over to you. Here's an example that Jessica and I have. Let us know what type of measurement you think it is. A hospital is worried that their surgical wait times might be one of the highest in their area. They decide they would like to look at some data in order to confirm this. What type of measurement is this? Take a minute on the chat to tell us what you think. Okay, seeing a few answers. So we would consider this accountability because it's something that the organization is comparing to others, and it's a result. I figured most of you would get this one, so we have a bonus question for you. Let's say that the hospital did pull some data, and the results showed that their data is actually doing quite well in surgical wait times, with the exception of elective orthopedic surgical waits. How do you think this information could potentially help them? Does anyone have an idea on the chat? Yes, that's right. So it would give them an idea as to where to focus an improvement project. Perfect. I'm going to do one more that is maybe a little tricky, but maybe not. You guys might prove me wrong. A team is interested in validating a tool that will help them to better identify patients that are considered large vessel occlusion strokes. They begin a pilot of this new tool in a few areas of Saskatchewan. What type of data do you think they're collecting? Improvement, research, improvement, and you are all right. That was a little bit of a trick question. So this is actually a real-life example of something that a team did in Saskatchewan, and they developed a large vessel occlusion stroke tool, and they did research on it, checked out the sensitivity and the specificity of it, but they also began to pilot it. So they embedded it in a real-life situation and saw how it worked with the EMS providers who were using it. So thank you, everyone, for playing along with that. So moving on, we've spent a lot of time talking about the differences between the approaches, and despite all of those differences we've described, what I really want to highlight here is that it's not a competition about which is better. It's not about one method being better than the other. All are necessary and speak to approaches and techniques that can be used to answer a question. Knowing which technique to use will depend strongly on what question you are trying to answer. Through being aware of both the purpose of your work and the characteristics of each measurement type, you will be able to identify the most appropriate measurement approach. The three approaches should not be seen as mutually exclusive silos. This is not an either-or situation. All three areas are necessary to help us understand a system. It's important that people who support this work build skills in all three areas. Organizations need translators who are able to speak the language of each approach and understand how they differ and complement one another. Problems can arise when people identify with one method and don't understand other methods and their values. It's important to have collective knowledge of all the tools and methods available to you. And one way that I really like to look at it that I think sums up how they can complement each other is that research can tell us the what, improvement can help us figure out the how, and accountability can speak to the where and the why. So one last time on the chat, I'm going to turn it back to you. Now that you've learned a little bit more about the different types of data, which type do you feel like you're gathering or working on in your real-world life? Is it the same, or was perhaps, let's say, what you thought was quality improvement data, a different type of data in disguise? Most people are saying it's the same. That's great. Okay, so just three quick key messages that we want to leave you with here. It's not a competition of one type of measurement being better than the other. They all have a valued place in improving a system. Knowing what question you are trying to answer is critical to know what type of measurement you need. And ensuring that your team is on the same page and understands the different attributes of each type of measurement is crucial to your success. Now I'd like to open it up for questions. Please continue to ask questions on the WebEx chat, and we will go through them and answer them as best we can. Yeah, Amy, you definitely can get a copy of the slides. I think they're available on our website, as Chelsea mentioned at the beginning, and there's also a recording of this presentation on the website that will be uploaded shortly after.
And so while we're happy to take questions on the session this morning, you'll see that the girls have also posted their contact emails. So even as you're working through things, if questions do arise, you can feel free to reach out to them. So we'll give it a couple more moments to let the questions filter in.
So it looks like we have a question here from Brian. Is it possible to apply control charts to things that aren't processes?
And I would say yes. You could take a result or an outcome. So let's say your surgical site infections, I think, could be seen maybe as an outcome, not necessarily a step in the process. It depends on the way you're looking at it. So I think definitely yes, you could plot those in a control chart and see how they're changing over time. One thing to remember about outcome or results-based measures is that we sometimes see them as lagging measures. So they might not change as quickly as a process measure might. So that's just something to keep in mind when you're plotting that data over time, that you may need more data to see if change is making an impact.
Yeah, and it looks like we have another question here. So can we talk through the risks of using one type of measurement for a different purpose? For example, improvement being used for accountability. That's a great question and something we've talked a lot about here, and it looked like a lot of people on the chat were doing measurement for both improvement and accountability work, so I wonder this is relevant to a lot of people. But I think the biggest risk is that you're going to end up doing neither well or to the success or have success that you want. I think in the end it really goes back to really thinking through what is the purpose of why you're measuring. What question are you trying to answer? Some of the things we see if we're trying to mix improvement work and accountability work is that accountability measures are focusing on outcomes, and as well as the data that you get can sometimes be it takes longer to get, so that by the time you're getting it, it's not as useful for improvement work. Anything to add?
No, I think it's just you run the risk of not doing probably either properly. So with improvement work, you want to use as current data as possible, whereas accountability, sometimes the data is quite lagged, especially if you're using stuff from our administrative databases. They're usually a few months lagged, and that can be hard for improvement work because it can be hard to remember something that happened 3 months ago. There's a question here from Sinead about, is there a recommended best practice to the amount of metrics you should be tracking or an appropriate mix? And I think she's talking about whether or not you look at process measures, balancing measures, and outcome measures. And that's one thing we didn't touch on in this presentation, but Jessica and I were wondering if we should include it, but in the end we decided not to. And yes, I think there are recommended best practices to the amount you should be tracking. I can't remember exactly what the numbers are off the top of my head. I would say it's probably a couple of each. Depending on your group and their workload, I mean, this is where a bit of the art and science come in. But Sinead, I'm happy to connect with you offline because I do know the best practices are out there. I just can't quite remember the exact numbers off the top of my head. Do you have anything to add to that, Jessica?
No, and I think we often find ourselves in situations where we want to collect everything and really thinking through that we don't want to just collect data or measures for the sake of collecting it. So thinking, again, going back to what do we really need to move forward. I see a question here from Janine. I find it difficult because we often use accountability data and expect organizations to do QI work based on this data, and the data lag is a real issue. Absolutely, and I think another issue that can come from that is sometimes the measures we use for accountability aren't granular enough to help us really get to the quality improvement work.
Mm-hmm. Yes, Janine, you're speaking to one of the biggest frustrations of mine, so it's definitely something that I think our system could improve on is separating the difference between the accountability data and the QI data and what we use it for. And Tom, I see you have said, can you provide or show an example of Brian's question? And I can't do that just right now, but I know you, Tom, and I have your email address, so I will connect with you afterwards to help you with an example.
Those are great questions. Thank you.
Chelsea's doing something here. I don't know what. Oh, taking the ball back. Okay.
A few slides to close us with if there aren't any other questions. But as we've mentioned, please get in touch with us if there's anything else you want to talk about.
Great. We do still have time on the call, so if you do have questions that pop into your mind, we'll certainly continue to answer those. In the interim, I just wanted to make a small plug and let you know that we've really upped our game here on QI Power Hour. I don't know if you noticed, but in the previous picture, our lovely researchers are wearing their very own QI Power Hour socks. So if you too want to get in on this sock action, we invite you to become a QI Power Hour presenter. So we'll have Caroline just sharing the link on where you can submit your ideas and your name, and we'd love to hear from you about what you think this community might like to learn about moving forward. I also just wanted to make a plug for our next month's session. Taking place Friday, May 31st, where we'll welcome Christina Southey and Jennifer Mervin to speak about their experience of leading BC's largest improvement initiative to date. So from 2014 to 2017, British Columbia was engaged with over 2,500 patients, including 2,500 participants, including over 200 youth and parents with lived experience, and 64 communities embarked on improving the child and youth mental health and substance use, both locally and provincially. So they'll be talking to us about that really large-scale experience, specifically honing in on the things that we might be able to learn here locally and those lessons that translate to different jurisdictions. So we'll invite you to sign up for that QI Power Hour either on our website, or if you're registered to receive our monthly subscriptions, you can expect to see an email about that coming your way soon. Great. If there's no other questions, then we'll thank you once again for joining us, and we wish you a happy and safe weekend.
Okay. Thanks, Chelsea.